Well, greetings.
Hey there.
How are you?
Good. Good to see you.
Good to see you too.
Right.
In physical proximity.
I know. Isn't this amazing?
It is, yeah.
No, COVID is not a problem. Well,
Just had a call from one of the guys that normally comes. He's COVID positive just half an hour ago.
oh, just going round and round.
But what is it that's going around? That's the question.
I know. So I got, I don't know if it's this variant, but about 8 weeks ago,
Yeah.
I got it.
Yeah, you told me.
Yeah, but it was just like so light. Yeah.
Yeah.
It was like, I don't know what variant I got. I mean, I was like quadruple vaccinated, but whether that made a difference or not, I don't know.
Yeah. So how did you test? You use it?
I had an at-home test.
Home test?
Yeah, but you know, I did report it to my doctor, and I don't know if he reports it to the CDC. I always think that the more that people testing at home report it to somebody, maybe the stats will be better, because right now I think the stats are underreported.
Oh, they're terrible. Yeah.
Yeah.
There's so many reports out there exposing what they've done with these numbers.
Yeah.
And
I mean,
it's tragic.
it is. We're so screwed up. All this.
Yeah, yeah. Pretty hard to do.
Yeah. Nobody knew what to do, and they still don't know what to do.
No.
So cute. All right, let me not play with this. This is so tempting. How can I play?
As I did.
Yeah, I'm gonna play with this.
Yeah.
So where do I put my?
I think you should sit here, but you're let's see. A couple of people have entered the waiting room.
Okay.
Let me think, where do you put that? I think you put it in. Would you know, or you want me to get Tony? He's good. Hi.
Hi, is this where the meeting's gonna be?
Yes, it is.
All right, I'm here, I made it.
What's your name? Chris?
Tom Chico.
Oh, Tom, yeah, Tom.
Hey, Tom.
David.
How are
David.
you?
Nice
Good.
to see
How
you.
are you?
Yeah, we spoke on the phone, I'm good.
That's
thank
right, we
Good.
did.
I was a little confused on where it was, I didn't see the team Tony part.
Oh, really? Yeah, it's right on, you put a sign up front.
Yeah, no, I didn't read the email, I just only read the address. And I'm saying, wow, there's a lot of them, but I put 2 and 2
Yeah,
together.
you can go to the real estate office. Let me see what shows.
So this is where the meeting is?
Yes. So I'm going to talk about nutrition today, and
Oh, we're gonna talk about nutrition.
Yeah. Well,
Are you a nutritionist?
I am. Yeah.
What is your name?
Nora.
Nora.
Nora. Nice to meet you.
You were a nutritionist at the hospital? And...
No, I work for myself actually.
Yeah.
I worked in facilities for decades, and then this last 12 years I've been working for myself.
There was a nutrition I used to go, but she passed away. Lee Prang or something.
Oh, yeah.
You know her?
Eve, what was her name?
Eve.
Prang or something.
Yes, and Eve makes, yes.
She passed away.
Yeah, she was a force.
Yeah,
She was a force.
she had a place, I think, down south of here.
Yes.
And,
Hi there. I put my flash drive in, I just don't know how to get it up and running. Nora, pleased to meet you. Right here. Right here. I put it in the back. So, oh, this is like a touch screen.
Good then.
Yeah.
Hi there. Hey, how are you? Good to see you.
Nice seeing you.
Yeah.
And this is so
Make
impressive.
yourself comfortable, getting organized here.
Yeah. Your USB? No?
It's probably that one. Is that you? Nope.
Yes.
That is you?
That's me. That is me. Cancel. Yeah. So we're good. The PowerPoint, hit that guy, right? Or I could do it. I see what you're doing. This is very impressive. Man. Okay, and then to get the slideshow, hit that, and then hit slideshow, like start from the beginning.
Yes.
which is,
Start slideshow. Yeah.
okay, that's good enough. All right, cool, and then
Now, how do we
that
make
will,
it
just
share
every time you
screen?
click, it,
But how do we share screen?
oh, yeah. So lower it, go exit, right click it, sorry, right click it,
Right click it?
and it'll say exit full screen,
Or hit escape.
or escape. Hello.
Hey, good day. How are
Welcome.
you?
I'm parked in that red feather spot, is that
Oh,
a problem?
$100 fine.
Yes, it is.
Oh,
You can
dear.
park in the back though. Always hold right in the back, and you want to make sure the door's open for you. Yeah.
Yeah, you can come in the back door, which is, we'll open it up.
Yep, I'll meet you back there.
All right, so now.
Oh, gosh.
We gotta get.
Oh, yeah.
our screen.
Yeah, we gotta get
gotta
exit
let
full
people-
screen so we can share, and then we'll do it later. Right click now? Ooh. Alright. Oh, there you go. I still say right click. Do it one more time. See what happens.
Right click,
Uh,
show presenter view.
You need to get back into Zoom.
End show, end show.
Possibilities. Yeah, you do that, maybe, it's that one.
All right, see now, okay, we're good. Now you
we're
can
gonna
get
do
back to Zoom.
Zoom meeting,
Mm-hmm.
that looks like it.
You get the
What's
party
this
started.
Zoom over here? We got Zoom up there twice. That has been confusing before.
I know who you are. You were in the Rotary Club with me. Oh, Tom Chinkle around here. Hey, CPA.
Question,
Good,
while
how are you?
I'm doing the presentation, it'll be off, the camera will be on me, so I can
Older and
kind of look at
grayer.
the camera, but also see, you know, so I'm reflecting on it. Okay, cool.
Right,
Good.
that's what we gotta do.
Yeah.
Getting older. Fingers are falling off.
Hey,
Why do I have
doing that with everybody?
here?
Yeah.
So what do you have?
That one you can close out of, there you go.
What, doing what, Rotary?
Yeah.
No, I haven't done that in 20 years.
Yeah.
I bet he invited me to a meeting last year.
Oh, did they?
Yeah, Bill Henry.
Oh, share screen.
He was trying to entice me to get back.
Yeah, I see Gary.
No, I
There you
don't
go.
have to point you.
Oh,
No, you're gonna be where I am.
We'll do that later.
You're gonna be where I am.
Okay.
And Bill Henry's still in.
Yeah, so when the time comes to share the screen, we don't need to do
Are
it
you
yet.
working?
The share screen actually when Wendy comes up.
And I'm not killing myself. I work when I want. You know, I'm not killing
Oh, Wendy's on
Oh,
it.
yeah.
Yeah, no complaints. No complaints.
I stopped. I stopped the line.
Yeah. So what are you doing with yourself?
You're hanging around.
Hey! Get out and about. You know? So, I've never been there.
Yeah, you should be live, right?
Yeah. I am down there.
Yeah.
I just started doing.
Oh, there you are. Now you are. Now you're live.
I did 1 or 2 days.
So,
Lock you out?
do you have,
Back door was locked.
Oh, geez.
how long have you had it?
Well, I found out in January. So
No,
I was diagnosed in January.
no, it's happening right this minute.
Who are you going to in town?
First guy I went to was Curtis.
Oh, Jerry Curtis.
June 20th?
I haven't seen him in a long time. I remember years ago when he was with Freeman and Barzell. They went out on
We've
their
got
own,
people
they
that
went
have started
back.
again.
Then I went to, I saw that radio.
Who?
Oh, that's a month ago. That was last month.
That's 21st century oncology. Yeah.
So,
Geez, do you have the more
Well, I go to him
recent
twice
or
over.
a recent email that has this one on
he
it?
wanted take it out, you know, shoot it,
Yeah,
and then I went to Kerry.
yeah, I know him.
And Kerry sent 4,500 of them, maybe.
I'll be
He
done.
said, whatever you want.
Huh.
I think it's like
Well, I
3,
don't
4,
know.
7.
What could I do? I could give you the code, I
Yeah,
guess.
I went to, see how.
Yeah, I think I can give you the Zoom number. You want me to do that?
He's in town?
Yeah.
Yeah.
Let me see where I can find this.
He's in a group.
He's a former head of NYU.
And where's he located?
It's,
Located in Lakewood Ranch.
you know, it-
So, yeah, probably. It is. He's early 60s. And he's has a concierge practice. So,
I'm not quite sure how we can get this number to you.
he's running something called
Oh, yes, yes, the meeting number itself, if that's there. Oh, but that's gonna be for the 20th, you think?
Oh, how'd that do? You did that?
looking at it right now.
So you have to decide.
There's something.
Well,
Well,
Bear with me a second.
I'm 22 years old,
Let me see if I can get this.
and I had a surgery 22 years ago. 6 years later, I had a reoccurrence, so I had radiation. Up until last year, I was fine. Then all of a sudden, my PSA was moving. I went to UCLA for what's called a PSMA test, so they can pinpoint it right down to where it is. And they found 4 spots, and then I had 25 radiation treatment. I've been on medication since last summer, a year ago. And I don't even go to urologists anymore. I go to an oncologist and a GU plus Moffitt.
I've been Moffitt.
Who'd you see at Moffitt?
Manley, what's the guy's name? Young surgeon. He's probably in his mid-40s.
And what was his recommendation? Surgery?
He said they just monitor. He said, you know, he could take it out.
I just wanted it out. This was,
Yeah, I didn't either.
I just wanted it out, and I did that because if you go, I think if you go radiation, you can't get surgery. But if you go surgery, you can get radiation. Some people do a combination of the two.
Well, this, see, this outfit, it's the least damaging outfit. All it does is burn a spot out.
They know exactly, they pinpoint
And
it.
they put the spot. Now they have this that I found out was this 3T MRI. So just had, they can actually see the spots on it.
You know, the PSMA test does your whole body,
Okay.
and it shows all the flash points.
Yeah.
Where it is, and when I did it, it wasn't FDA approved, and it was UCLA was the only place in the country that did it at that time. So I flew up there a year ago, May, then the FDA approved it, and now you can get it locally.
The one that did it was down there on 41.
Rogers Imaging, yeah, I've been there many times. Believe me, I hit them all. I hit them all. You know, you never get enough information, and believe me, since I was diagnosed, the technology and everything has changed.
Yeah, I could see that.
Well,
This guy, what's his name?
yeah,
He didn't get this service.
why, what do you think?
Well, originally I went to him because my guy, Gavin, went out of it, he stopped doing it. So I did to this guy, and he did a biopsy on me. For over saturation biopsy. So 49 samples.
usually take about a dozen or so.
And this guy here, so, he said, can't believe that you did that.
Yeah. One time I asked, because I had 2 biopsies. And I asked when I had the second one, I said, how do you know by doing this, you're not spreading it? He couldn't answer.
What'd you say? What did you?
You're not spreading the cancer by doing your biopsy.
That's exactly what I said.
And they couldn't answer me. I said, I'm not, I don't like it.
It's called seeding. Okay? Take the air, take it out, and control it around and around. But now, with the guy that put that MRI,
They didn't have all that.
they can go right down.
Well, we got a little bit of a screw up with the link here.
He did 49. All he did was go.
People have gotten in.
I don't know.
This gentleman's got the wrong number in the email, and somehow I must have mistakenly,
Lose their license.
they're all in, these numbers are all.
Well, the good thing is that you're doing something.
Wendy, bear with us a few minutes, we're trying to.
No worries.
Trying to find the number for this meeting, and it's gotta be in here somewhere,
I seen it, Tom.
Can we look at my email?
Yeah.
I don't
but
know.
apparently, yeah, oh, the one I sent you was on yes. Yes.
So quickly,
I
good.
think that when I was here, Dave did some work in my house, maybe 6 months ago.
Where's
this
Dave,
according-
Matthias.
This says
Yeah.
837-406.
What's he doing? He's changed careers a
I
lot.
don't know, well, he's been doing it, remodeling.
Oh,
yeah.
Well, I haven't done anything to get on, to be honest. I'm just-
Hey, look who's here.
We did last time.
At his age.
Does he do it himself, or he just sub it all
Yeah,
out?
he does, no, he does it himself.
Restroom back there, Dave?
There is one back there, yes.
Of course, his knees are giving out.
Almost all the way to the end there.
Backwards.
All right.
837-406. 4957. But that doesn't seem to be working.
How old is he now? Wow, I didn't realize that.
Oh, here's Tom.
How old are you?
73.
Oh, here's Tom signing in right now.
Yeah, I just, last week.
Tom, are you in?
It's a big 8, oh boy, yeah.
I am signing you in.
It don't matter anymore.
If, you know.
What number
your age, I
did you
would-
use?
No, that's what he said, they're all telling me that, you know.
Yeah,
That's what that CM.
I'll be
You
darned.
know, that'd be a little.
Yeah, 'cause you
I'll
wanna
be
get
darned.
surgery
Well,
and all this shit.
Some glitch.
It's
Well,
all-
thank you very much.
I mean, you do, I don't care
Thanks
what
for your
it is.
patience.
You're gonna get side effects.
Yeah.
And you wanna
Okay.
deal with all that
I
shit.
think we're ready to roll.
No, this is
All right.
one of the movies.
Let it come back. Yeah, you should stay over here.
Okay, sure.
Excellent.
Well, I mean, if you want to introduce, so
Well,
I can just switch with these.
Every
Yeah,
Tuesday,
I see.
and it's people from all over the world.
We're up to,
Tell you all the different treatments.
What is it?
It's called ANCAN.
What's your password?
ANCAN. It's advanced prostate cancer. And what they do,
What's your
they,
password?
you can speak Q&A, you'll have doctors, that people who've had sex.
He's gonna log in.
He got it.
People
He got it.
that
So you're good.
20
Yeah.
years.
Thanks.
And let me tell you, you get more information from that.
Well, folks, I think we can get started. It's 2 o'clock or a minute or 2 or 3 or 4 after, and I apologize, it's 9 after. So apologies for the delay. We had a little bit of a computer glitch. So I might have to shut the doors now.
all the slime saying serious parasites.
Because you gotta go Louis and 7.
Yes.
Uh,
I take medication.
Because we
But I-
go in here, guys, maybe we didn't realize the conversation here.
Yeah, okay, so we've got a pretty interesting and exciting presentation today, which we've had the great fortune to have a couple of very important nutritionists, one of whom we know reasonably well, Nora Clemens, who's right here with me. And Nora has been with us off and on over the years and has made presentations. Oh, here. I forget that you can touch screen. And we've talked about nutrition and its importance. Obviously, it's extremely important as we battle cancer and as we prevent it and as we take care of it after the fact of any kind of treatments. And the second person who's joining us today is a woman who came to my attention a few months ago, really, when she had a presentation about a possible clinical trial that made some interesting information from my point of view. So Wendy DeMark-Wanfried is professor and Webb Endowed Chair of Nutrition Sciences at the University of Alabama at Birmingham. And she is going to follow Nora with a presentation and talk a little bit more about nutrition and about this study that's going on and what they do at the University of Alabama at Birmingham. So without further ado, particularly since I'm late, let's let Nora go on with her presentation about information that's important for all of us.
All right, thank you so much. Thank you for having us both. David, hi guys. This is a little turn the head action over here for me. We'll be looking at you. We'll be looking at you, camera, I suppose, in a minute. And I am needing to, is this it?
Yeah, I think so. We're trying to get the screen set up so you can see Nora's presentation along with the folks that are in the meeting.
How about your screen? All right.
That's kind of.
All right.
Okay.
Let's see. All right, so we're going to get this thing started. As David was saying, actually, you've got two registered dietitians today. You've got Wendy, you've got myself. She is in the academic and the educational side, research side. I'm in private practice. I have my own practice here in Sarasota, Bradenton area. I'm actually virtual, so I can help people with nutrition practically anywhere. So with that, we're going to get started with this presentation here that I put together for you. If I can manage, yes, I think I've got it. So here we go. Today, the focus I'm going to have on nutrition is that nutrition is information. Okay, so we're going to, that's sort of keep that in mind as we go through. Nutrition is information. You know, food is medicine, all right? Think about how food keeps us alive, if that's not important. Food is information for our cells. When we eat, all of those nutrients wash across our cells, make contact with our cells, and at that point, that is the way that we can impact the way that we are expressing our genes. So with good nutrition, we can certainly have our genes express themselves to the positive. With things that are not so healthy, that are inflammatory, that's when the opposite can happen, and we're talking disease. So, you know, we have so much power through the choices of what we eat for our health. And I like to say, you know, inflammation is the root of all evil. Sorry about this, guys. And, you know, here are some of the diet-related foods or things that we put in our body that can cause inflammation. You know, sugar, of course, is inflammatory. Processed foods, These are things we've already heard, chemicals and pesticides that already exist in our food and water. Trans fats are man-made fats, artificial fats that are sometimes in our processed foods. Artificial sweeteners and colorings. So these are all things that really are in processed foods. And in some people, it's inflammatory when they eat gluten or dairy. That's, people that we know this through testing and working with them to diagnose that. But this is just a small list here of things that we can think about that can cause inflammation. So let's learn about how to tackle that. And okay, here we got somebody else. There we go. I'm multitasking here. So, hello there. Yeah, if you can put yourself on mute, whoever just joined us, we would greatly appreciate it. Thank you. Thank you so much. Okay, so our bodies are one big chemistry lab. I mean, I know you don't think of it that way, but we, our food and the things that we put in it, they're biologically active. So those things can either cause inflammation or they can be anti-inflammatory. And when you think about inflammation, this is what we're talking about. It can lead to cancer, to respiratory issues, cognitive, brain issues, digestive, liver, kidney, cardiovascular. There are no limits to which inflammatory processes will trigger off depending on our genetic makeup, right? And how we inform those genes, how those genes can be expressed. Inflammation can develop to promote cancer. So, healthy eating habits. This up here, guys, says variety. So, variety is the spice of life, not just because it's fun to eat different foods, but think about it. If we eat the same 15 foods every day, you're going to get the same 15 or 20 nutrients every day. And what about the other 25 to 30 nutrients that we need? So it's important for the sake of just getting well-balanced nutrients and nutrition that we eat variety. When I say a whole food diet, that just means not processed. Food in it's like, green beans or, brown rice or chicken. That's a whole food diet. And so we do need to eat an abundance of fruits and vegetables because as we were talking about earlier, the inflammation, these are the anti-inflammatory foods. Organic just helps us to have fewer chemicals and pesticides. We talked about that earlier. There is a guide called the Dirty Dozen and the Clean 15 that helps us to, pick which ones are the crucial ones that we should maybe choose organic if one has a disposable income. The Clean 15, not as high in chemicals and pesticides. So again, whole grains that haven't had, their whole entity torn apart and removed, the fiber and the nutrients. Plant-based oils, we're going to talk quite a bit about these. So we're already eating these things, but oils in the actual foods themselves, avocados, oils, nuts, seeds, nut butter, yum. So these are all good. Eating less dairy and less red meat, which is, the direction that we are told in pancreatic cancer to reduce those foods and to eat more wild-caught fish and seafood. So excellent form of protein there. Again, veggies need to be half of the plate. I know, how in the world? Well, it's baby steps. If you're not doing it now, just think about eating vegetables. And then once you do, think about eating those 2 to 3 cups a day, because that's really what we're talking about. If you could put some spinach and onions into your, egg scramble in the morning, gosh, you've got veggies going on. And then these all down here are all the cruciferous vegetables. Those are our power veggies. If we can eat a lot of these throughout the week, we are, again, bathing our body, washing those genes with cruciferous vegetables, nutrients that will help to power up the protection that we need against, the runaway, DNA replication, which is cancer. So these are protective for us. So yes, these phytonutrients, that's a word you might read about sometimes, those are the chemicals in plants. Those are the ones that are really helping us to fight the fight. They are the antioxidants protecting the cells, making sure that we've got good hormone activity, protecting us, antibacterial. You know, who can't use antibacterial when there's organisms all around? We want to be able to fight our own defenses with a good immune system. And in the Journal of Natural Medicine, May of 2019, there was some guidance that was provided. I just want to review these things with you. I don't think that a whole lot has changed, but these are general things for good health anyway. A few specific to prostate cancer, but don't smoke. You know, try to have a good weight, a BMI under 27, vigorous exercise, okay, a few days a week. Lots of vegetables, cruciferous, we just talked about that. Eat more fish and plant fats. And we already touched on that. Really, years ago, because of some research which has now been re-looked at in terms of the analysis of the data, we were telling everybody to fear fats, to stay away from fats. Some doctors still have not caught up with this century and are not explaining properly that fats are not the enemy. It's sugar and processed carbohydrates. We are to be eating these things and not be fat phobic. These are healthy for us, so please lean into eating these things, not in excess because fats are concentrated in what they deliver, but fats are healthy for us. I just wanted to clarify that. And of course, really, eat less carbohydrates. It's so easy to eat more carbohydrates. Drink coffee, it doesn't affect things one way or the other with respect to cancer. Limit consumption of eggs and poultry skin, not the poultry, okay? Limit whole milk consumption, especially if you have a higher BMI. And then, yeah, so, you know, that ends the list of things that, you know, just, they are all repeating themselves here because the message is pretty much the same. So when it comes to proteins, yes, you know, lean proteins are good. Of course, we want to have less red meat, right? And, you know, low mercury fish is good. What is that? Salmon, sardines, herring is even good. So, and there's a list out there if you want to find out which one are the low mercury fish. But yeah, you can get proteins from beans, nuts and seeds. Again, you know, we went over this part. And, you know, eating organically is something that we can do as a person's budget allows. When it allows it, absolutely, you are consuming fewer pesticides and chemicals. I mean, that's just the reality. And they are, you know, full of nutrients. But guess what? I'd rather you eat more vegetables, even though they're not organic, than less vegetables. So just eat the good food, whether it's organic or not. Organic would be ideal if possible, but it's all about making the right choices. So I just really wanted you to be clear on my mentioning organic. That is really as a person's budget allows. Again, the wild-caught fish is good, and vegetarian meals are really becoming a little bit more popular, which I'm super happy. But, you know, beans and rice, nothing like good old beans to make a good plant-based meal. But also, you can make tofu taste like chicken. You can make tofu taste like anything with whatever season you have in it. So again, vegetarian meals at least one day a week, a couple times a week, or a lunch and a dinner would really be helpful. So you can definitely get your protein this way. Again, plant-based fats is where it's at. I've mentioned some of these. You know, it's because they are healthy, they are good choices. And, you know, again, eating less whole milk dairy products is a good idea, and eating less animal fats, because think about it. When any of us, including animals, eat anything that has a toxin in it, where do you think it goes? Do you think it goes in your body and right out the body? No, sir. We are amazing at efficiently storing things that come into our body. So we store those chemicals and pesticides in our fat stores. So the less animal fat that we eat, it's better for us in a number of ways, but the fewer of the cancer-causing types of toxins that are found in animal meats and poultry. So as time allows, I'll take questions. If you guys have any questions about what do realistic breakfast, lunch, or dinners look like, we can take that up. You know, Wendy's going to talk about a great opportunity for you to be a part of a community that gives you support and guidance, even part of a study, which I think is super valuable, you know, if you qualify and you want to get into it. But if so, that would be fantastic. I offer one-on-one help, so you can certainly give me a call and, you know, schedule an appointment, and I'll give you a personalized plan. However, you know, sometimes people want to do a little bit more advanced testing. Happy to do that so that we can really take a close look at where you are at and what your needs are. So to summarize here, I want to say that we need to think about elevating food to a place of importance. The reason I say that is a lot of us don't. A lot of us just go, oh, I'm hungry. Oh, look at this. This looks good. It's ready to go. I don't have to cook it. I don't have to think about it. Here, let me just have it. So, and I know that's really, you know, extreme, and that's, you know, possibly none of you here. I hope that's none of you here. But knowing that in my business, that's what I hear reported. It's like, oh, let's go out for eat. Let's get some takeout. That's not elevating food to a place of importance. What that means is being intentional about your food choices, shopping, kind of thinking about what you're going to eat, have healthy food ready to go. You know, remember what I said today. You have the power. It is in your hands what you put in your mouth to have the best health. You can have antioxidants, or we can have inflation. You know, create an environment where cancer cannot survive. And I love this slide. I use it all the time because it's so powerful. Food can either be the safest and most powerful form of medicine, or it can be the slowest form of poison. So think about that. I do have this handout here that we can send out to all of you. These are great resources for you to look up, you know, some of these things about seafood, meatless eating. Foodjucate is a wonderful app, and EWG.org has a plethora of free information. So yeah, be good to your body. It's the only one you'll have to live in. That is it. Questions from the peanut gallery out there or from these guys?
I've got a question.
Yes, go for it.
When you are eating chicken,
Yes.
should you remove the skin before you eat it, basically? Or just not eat chicken that's got skin?
So you can cook your chicken with skin because really the fat will not penetrate the meat itself.
Okay.
Take it off and the part that is not as healthy for us is officially gone.
Okay.
Yeah.
So you can cook it with it.
Yeah,
but,
absolutely.
yeah. And then with steak, which I rarely eat, but occasionally, should you cut off any fat around the steak itself, or should you eat some of that?
You know, I think the same thing applies. You can cook your meat as you have it. I mean, with both of these, with skin on, I mean, it's tempting to have a nice piece of chicken with skin on that you go, oh, that looks so good. Am I really going to take it off? You have to know yourself. But same thing, you know, cook your steak as is. You don't have to dissect it ahead of time. But, you know, when you sit down, trim the fat. So good. Don't eat it. That's what you want to stay away from. And that way, you know, it's more palatable because it looks good.
Yeah.
You want food to look good as well. Yeah.
Anything else, guys? Well, yes.
Sometimes when they advertise these farmed salmon
Yes.
in the ocean,
Yes.
is that still, do they farm them all in the ocean?
Yes. That is actually one of the most brilliant things that they've done is to farm seafood, shrimp, salmon in the ocean, because there, you know, you cannot pen up all the waste and things like that. You just have flowing water, and yes, at intervals, you know, they drop the feed. I have done some research on that, and the people that have this type of farming are feeding their fish healthy food, which is the other factor.
So that's okay to eat.
Yes. Farm raised, I think that you have to say, is it farm raised in the ocean? Yeah. And by the way,
Most places that I've seen don't put that in there.
Right.
It just says farm raised.
like for example, in the grocery store, the frozen fish that says farm raised, I have no idea what type of farm raising they utilize. So unless you can ask, for example, Detweilers, oh my goodness. If you don't live in Sarasota, sorry, but we have Detweilers where they really source their fish from, because I have grilled them, I've spoken to the, purchasing manager, and they are awesome. They're honest and they are amazing. They have good seafood options.
Good to know.
Yeah.
Love seafood.
We're in Florida,
Yeah.
and they have veggies galore.
Well, let's move on to Wendy's presentation. Yeah, it's a little hard to see you, Wendy. I think you're there. Yeah.
I'm here. I'm back.
You're very audible. It's very clear.
Oh, good.
Yeah, I just wanted to add a couple of notes to my previous intro of you, because your history with research in this field is tremendous, and I think the guys ought to know about that. So a couple of things that I'm kind of reading off the list, but I know it's extensive, and you've been supported by 16 NIH grants, which has resulted in over 300 peer-reviewed publications. That's a lot. That is quite a lot. And you've also been recognized as a Coleman Professor of Survivorship and an American Cancer Society clinical research professor. So I could go on and on, I'm sure, but nonetheless, it's important to know that the research that you represent is extremely valuable. So I'm going to just turn it over to you and let you move ahead.
Okay. I think what you're going to have to do is enable the screen share.
That's right. That's right. I knew there was a technical procedure here.
At the bottom,
Yep. I think I may have to make you co-host, though.
I don't know. I think you could just do the screen share. Oh, still not there. Let me know when you're set.
I think we need to make her a co-host.
Well, while they're getting set up, I just want to say thank you for allowing me to intervene on your meeting here. And I think Nora gave a really great presentation. I'm going to go back and emphasize some of the points that she has made, but I think she really gave a good foundation. And then I'm going to talk to you about a study opportunity.
Do you have the screen share?
I do. Thank you.
Got it.
The question is, where in the heck is my thing? Hold on one second. I see that you have my budgets here for my various grants, which I don't necessarily want you to see, but I guess you have the.
I think we need to post.
Oh, here we go. Okay, Sarasota. Do you see them?
Yes.
Wonderful. Let me start from the slideshow then. I'm beginning. Okay, so I'm going to follow up with Nora's presentation here and talk about diet and exercise for cancer survivors. Again, it's great to be here with you guys, and I'm just going to cover some of the key, emphasize some of the points that Nora made, and then maybe add a little bit more information. So the big thing is why should I care? Why should it, really matter about what I eat, how much I move, how much I weigh? And the fact of the matter is that the incidence of secondary cancers is growing rapidly. In fact, it makes up one of the leading causes of cancer now annually. And 1 out of 5 people that have been diagnosed with a cancer this year will have had a previous cancer diagnosis. This is not a club that you want to belong to. One cancer is enough during a lifetime, and I'm sure many of you will attest to that. So how can you spare yourself from a second cancer? And then not only that, but cancer survivors not only have a higher risk of developing a second cancer, they have more than double the risk of dying from heart disease, which is kind of hard, information to process. If one doesn't get you, the other one is right around the corner. So how do you prevent that from happening? And then at the very least, you may feel a lot better, sleep a lot better, and function a lot better if you ate better and became more active. So Nora showed some guidelines, and I'm going to show you these two different sets of guidelines. One is from the World Cancer Research Fund, the American Institute for Cancer Research. And they have perhaps the most complete guidelines. Many of you might get like a newsletter from them every month. They have an AICR newsletter. They are an organization that does complete reviews of the literature on a continuous basis. They analyze it at the Imperial College of London, and they really do know their stuff. The American Cancer Society also makes guidelines, and what they basically do in making their guidelines is they take the guidelines from the WCRF and then they kind of use their own amalgam of basically taking recommendations from the American Heart Association, the Dietary Guidelines for America, and kind of glomming them all together so that individuals have perhaps a more easily digested message, if you will. So at the very top of these guidelines, and again, one is sort of dependent on the other, so it's not a big surprise that these guidelines align really quite a bit, is be a healthy weight, achieve and maintain a healthy weight. Now, I only can see part of you in the audience there, and I must say the three specimens that are sitting there by the blackboard look as though they are right in the ideal body weight range. So I commend you for looking so fit. And now I'm going to kind of review the evidence for maintaining that healthy weight, just in case there are some of you that are perhaps a little bit more over upholstered than these three guys that are sitting by the blackboard. So the fact of the matter is that obesity plays into the risk for 13 different cancers. And it affects cancers like breast cancer, endometrial, colorectal cancer, non-Hodgkin lymphoma, a whole host of different cancers. Prostate cancer, however, is not one of them. So you don't get you're not more at risk for prostate cancer if you are overweight or if you have overweight or if you have obesity. However, once you've been diagnosed with cancer, then the meter starts running for prostate cancer. And I'm not sure if you can see can you guys see my pointer on this slide as I'm moving it?
Yes.
You can. Okay, so here are graphs that show obesity and cancer mortality for females and males. And there's 15 different cancers that are depicted here. And as you can see here, prostate cancer's at the top, and the point estimate there is 1.34. Well, what does that mean? It means that men that have obesity are 34% more likely to die of their prostate cancer than men who are of normal weight. So is that bad? Well, it's not as bad as if you had liver cancer and you had a risk of 452 times as high. But it is elevated, and it's something that you should take into consideration. We also know, so that's weight at the time of diagnosis. How about weight gain after diagnosis? There are studies called meta-analyses. Maybe some of you are scientists out there and you know what these are. What meta-analyses are is they basically are statistical analyses that pull all the research that has been done in a particular area, pool the data from all those studies, and then do a whole different set of analyses on that. And there have been two meta-analyses that have been done on weight gain after diagnosis. One was done among women with breast cancer. One was done in men with prostate cancer. And I'm going to focus on that one that's on the bottom row there, because this is obviously a prostate cancer support group. So this meta-analysis was done in 6 cohort studies. Over 18,000 men participated in this study. And what did they find? They found that men that for every 5 kilogram per meter increase in their BMI that they had after their diagnosis, their chance of having a biochemical recurrence, meaning their PSA would go up, was 21% higher. And their prostate cancer specific mortality was 20% higher. So here we got 2 messages. Not great to be overweight or not great to have overweight or obesity at the time of diagnosis, and not great to gain weight after diagnosis either. So here are two strong pieces of evidence that you need to consider if you fall in that weight category. So here is a BMI chart, body mass index chart. And how you use this body mass index chart is that you basically find your height on the vertical column there, the very left-hand column, and then you trace it over and you find your weight. Now, if you were, I'm just going to kind of take a height, for example. I'm going to take the average man. So the average man in the United States is 5'8" tall. And if that man, and I'm trying to find my pointer here, all of a sudden I've lost it. Okay, so if that man is anywhere from 125 to 158 pounds, he's in what we consider a normal weight or an ideal weight range. If, however, that 5'8" tall man is 164 to 190 pounds, he's considered overweight. And then, oops, sorry, let me go back. And if that man is 191 to over here, he would be considered in the obese range. So find your weight and then see how you stack up with regard to this BMI chart. If you are in the red or in the yellow range, it may not be, if you've been overweight or obese all your life, it may not be possible to get down to your normal weight range, but you should at least try to push it in the right direction toward the green. So go toward the green there. So, and truly, again, do you have to get down to your ideal weight range to see health benefit? Well, not necessarily. As little as 3% body weight loss can really give you some health benefits as far as your lipid levels that will help with heart disease. How much, if you are in this overweight or obese range, how much weight should you lose? Oftentimes people get really carried away. They say, oh, I want to lose it as fast as I can. Well, there is a range that is considered healthy. And a weight loss of up to 2 pounds per week in adults is really what you want to shoot for. Though if you are over 60 years old, then you want to go slower. Well, why is that? Anybody want to take a guess why it's important to go a little bit slower if you are over 60?
It affects the heart rate.
It can affect the heart rate. Yeah, not the answer I was looking for.
Too much work.
It is a lot of work to lose weight. And you only want to do it once, right? You don't want to have to do this yo-yo dieting time and time again. Your heart is an example of one of the big muscles in your body. If you really push weight loss too fast, you're going to lose a higher percentage of muscle. And that's really important if you're over 60, because already your muscle is starting to dwindle over time. And it's a condition called sarcopenia. So if you are over 60, you really don't want to lose weight faster than 1.5 pounds per week. And that's important, because if you lose a higher proportion of muscle, what happens is that the body, your future energy needs are based on your muscle mass. Your calorie needs really are dependent on how much muscle you have on your body. So if you, with a weight loss program, lose a lot of muscle, you're going to be setting yourself up for failure to keep that weight off long term, because you're going to be losing that muscle and therefore driving down your calorie needs. So even though, nobody wants to be on a diet for a long period of time or cut their calorie intake, it's important to proceed wisely. For men and women in the adult range, it's usually around 1,200 to 1,800 calories per day, about 1,800 if you're a male. And you do that and the very important thing here is to look at the bottom of that pyramid. Yes, diet is important and is key to losing weight, but so too is boosting physical activity, and then behavior modification, lifestyle modification there. And those are kind of that's the foundation of losing weight. Surprisingly, when you look at all the weight loss studies that were reviewed by the committee that makes the guidelines for overweight and obesity, there is no recommendation for the distribution of carbohydrate, fat, and protein. Now, I know that we've all been inundated with, the keto diet, you want to avoid carbs. Well, the evidence really isn't there. So there is no recommendation. Calories really play the largest role. And there are certain techniques that you can use to really help yourself. Weighing yourself every day, keeping a food and exercise log is really a key to really maintaining weight and getting that weight down and then maintaining it. So the next thing, physical activity. And the recommendations: be physically active, try to do 150 to 300 minutes a week of moderate physical activity, and limit the amount of sedentary behavior that you have. So here are the guidelines from the American College of Sports Medicine. And they find that physical activity really helps in the prevention of 7 common cancers, of which prostate is in there. And it really does play into the survival of 3 more cancers, and breast, colon, and again, prostate cancer. So physical activity is important for prostate cancer prevention, as well as prostate cancer control. And it also helps very much with the symptoms that are listed there in the left-hand column, such as fatigue, improving quality of life, improving your ability to do various tasks and to stay independent. It also helps with anxiety and depression. Lymphedema is less of a problem for men with prostate cancer, but it does happen. And physical activity is important for preventing lymphedema, getting the lymph all circulated. Dietary pattern. So Nora talked a little bit about this in her presentation here. What you really want to do is focus on a plant-based diet, eating a diet that's rich in whole grains, vegetables, and fruit. Sometimes that's known as a prudent diet. The guidelines from the American Cancer Society are the same, although they basically say, we're going to give you some recommendations for vegetables. Try to pick vegetables that have a lot of phytochemicals in them. And how you can determine how many phytochemicals is usually by how colorful they are. So iceberg lettuce, for example, is just an exercise for chewing. You don't really get too many phytochemicals from iceberg lettuce. Whereas if you eat romaine, if you eat spinach, well, those have more color in them, and therefore they have more nutrients in them. So dark green, orange, red vegetables and fruits are good. And then whole grains. And what are you supposed to limit? Well, red and processed meats. No more than 12 to 18 ounces of meat a week. So 12 ounces if you're a female, up to 18 ounces if you're a male. That means that you're going to have some meatless meals or rely on chicken or fish for other meals during the week, because 18 ounces is not going to get you through the whole week, particularly if you're eating meat for lunch and dinner. Avoid sugary drinks, and then try to avoid highly processed foods and refined grains. That's that. How important is diet quality? Well, again, one of these meta-analyses was done looking at diet quality. And I'm just going to alert you, it's important for reducing overall mortality by about 20%. But if you look at cancer, you can reduce cancer incidence by 14%, and then dying from cancer of around 18% if you have a diet that is high in quality. So very good evidence that this is helpful. So cancer survivors who are eating a healthful diet lower their risk of dying from cancer by 18% and dying from other causes by 17%. So very important to do. And then the last thing I'm going to cover is alcohol. I limit alcohol if you drink to 1 to 2 drinks per day. And then the American Cancer Society just came out a little bit, their guidelines are a little bit more recent, and they say it's best not to drink alcohol. And the reason is with alcohol is that the risk for various cancers is what's considered linear, meaning there's no safe amount. And here are the various cancers that are really affected by alcohol. So head and neck cancers, breast cancer, liver cancer, colorectal cancer. Alcohol damages cells. If you smoke and you drink, it's like the double whammy. It's even worse. It affects hormones that are linked to breast cancer. Maybe not so much of a cause for our concern for prostate cancer, but if your wife has breast cancer and you are a dual cancer family, best not to drink. And the evidence, we always used to say, well, you know, alcohol is not great for cancer, but it does protect against heart disease. And now we find with the latest evidence from studies that are done in heart disease is that it isn't as protective as we once thought it was, which is unfortunate because I enjoy a glass of wine just as well as almost anybody else. But this is sobering news, no pun intended. So now I want to just move on to this study opportunity. This is a National Cancer Institute funded study. It's our latest one on the block. It's called Amplify, Aim, Plan, and Act on Lifestyles. It is supported by not only by the the National Cancer Institute, but also by the American Cancer Society. And those of you that have knowledge of clinical trials, there's the clinical trial number that's there. Clinical trials are really important to participate in. It's how we learn what works best for cancer. So maybe some of you have already participated in the clinical trial, and these are all listed on clinicaltrials.gov if you have an interest. So what is Amplify? Amplify is a web-based diet and exercise trial for cancer survivors who are committed to taking the next year to lose weight, eat healthier, and move towards better health. So again, you three guys by the blackboard may not be eligible for Amplify because you just are not overweight. But maybe some of you, some others of you in the audience would be interested, or somebody else that is interested. By logging in only 15 to 20 minutes each week, and then by interacting with the program, it's a 48-week program, cancer survivors can begin their journey to better health. And we're getting some really fantastic results with this. So I am really kind of encouraged by the data that we're getting so far. It's a lifestyle plan that's safe, evidence-based, and personalized just for individuals. So some details. This is a intervention that's done totally over the internet. You can participate from your own home. You can access it either via computer, tablet, smartphones. It's totally free because it's sponsored by the National Cancer Institute. And it is a clinical trial. You can't say, oh, well, I want to participate in this intervention. There are 3 interventions within Amplify, and because it's a clinical trial, you are randomized. So one of the groups that a person could be randomized to is 24 weeks of the diet intervention, followed by 24 weeks of exercise. Another intervention is 24 weeks of exercise, followed by 24 weeks of diet. And then the other one is a combined intervention where we kind of mash them all together. As elementary as it sounds, we don't know which of these programs will work the best. And we have data that suggests that, well, maybe if we toss a very complex intervention to people, it might be overwhelming. But then again, we know that cancer survivors are up to some challenges, so maybe it won't be overwhelming to them. And it's important to know this question because after we get done with Amplify, we are really going to hope to blast it as a standard of care across the country. It does have an optional Facebook group. We know that a lot of people don't like Facebook, but we also know that some people love Facebook. So it's an optional part of this program. People can participate in it if they want to. They don't have to if they don't want to. And then we give people scales, pedometers, exercise bands, portion plates that they can keep. Again, these are all the costs of these are covered by the National Cancer Institute, and the interventions are all based on the recommendations that I just showed you. So they are evidence-based. Things that the Amplify participants will learn: safe ways to lose weight, safe ways to exercise, and exercise that really will help you maintain physical function the best. Ways that you could reduce exposure to pesticides. Nora covered some of these. We have a whole module on reducing pesticide exposures, dietary supplements. We have a module on that. Sugar, alcohol, meat, etc. Tips for grocery shopping, meal preparation. We have all kinds of videos with recipe demonstrations, eating out, that sort of thing. And here are just some quotes from people that have gotten done with the program. And I'm just going to read the one that's in the center because this is a man with prostate cancer. I'm a 68-year-old prostate cancer survivor. Before I started Amplify, I was completely washed out. I could barely walk 100 feet without having to stop and catch my breath. I've enjoyed the program. I'm eating and sleeping a lot better and I have lost weight. And this is a man that really was missing out on he had to his family that needed he and his wife to watch after their grandkids, and he couldn't keep up with the grandkids. Well, now he can. Over the course of the past 12 months, Mr. C lost 16 pounds, 10% of his body weight, and improved his endurance. We do measure people. We measure them before they start the program, and we measure them throughout the program. And he increased his the number of steps he could do in the 2-minute step test by 27%. Other people have lost even more weight. The two examples of breast cancer patients on either side of this man lost even more weight, but this man really didn't have that much weight to lose. He was in the overweight range, not in the red range that we showed before. It is a study, so we do measure, and here are the different measures that we do. We do surveys by phone and computer or computer-based questionnaires. We do Zoom assessments. So we get people on Zoom and we measure their weight and their waist circumference. We measure blood pressure and resting heart rate. We basically send people a blood pressure cuff and we say, okay, slap that on. Let's see what your blood pressure is. And then we do a series of physical performance tests, 30-second chair stand, various other 2-minute step tests, various other tests that show us how fit you are. The really cool thing that we do is we also measure muscle mass. And the way that we do it is through the D3 creatinine dilution method, whereby we give our study participants a little pill. You can see it right there. It's D3 creatine. You can get these, this is used as a supplement for bodybuilders. This is a stable isotope, which is very safe. This test is done in infants. It's done in nursing mothers. So we know it's safe. So you take that little pill. 3 days later, you pee on this test strip. We know how much muscle mass you have. So it's a really cool, very interesting test. And then what we do is we ask people to do a finger stick test. So we send a little Lancet and they prick their finger. They put 5 drops of blood on a card. They send it back to our lab. We analyze it. And then what we also do is, we tested for the inflammatory markers that Nora was talking about. Activity monitor we also have people wear it at 1 week of time at baseline, 6 months and 12 months. So it is a lot of testing. It's something to consider. However, we do pay $20 each time we ask people to do these tests. So we know it's a pain in the neck, but again, this is a study and it's very important. The National Cancer Institute wants to know if this intervention works. So here's our eligibility criteria. You got to be 50 years or older. And you got to be a survivor with the following cancers. So maybe this isn't your cup of tea, but maybe you know of a cancer survivor that has had breast cancer, colorectal cancer, or any of these cancers that are listed there. They have to be in that obese or overweight range. So either in the yellow or the red range. And they have to be pretty, they have to have their physical activity less than 150 minutes a week. We don't want people showing up that play, singles tennis 3 days a week. We want people that are sitting in front of their TV. And that are going to be a little bit of a challenge for us. Not enrolled in a diet and exercise program. They can speak English and completed the 8th grade. Because again, we're testing a computer program and you have to have a certain amount of literacy. So with that, I'm done with my presentation. Here's how you find out more about Amplify. And again, it may not be your cup of tea, but if you have a sister with breast cancer that lives in Iowa City that could benefit, hey, we'd love to have her. And with that, I'll take any questions. Thank you.
Wow, thank you, Wendy. It's a lot of information.
It is.
I'll make sure that we get the Amplify information out to everybody, even those guys that were not here today.
Thank you. I appreciate it. And I'm happy to take any questions. It doesn't have to be about the Amplify trial. If it's about, diet and exercise, I'm happy to take any
Okay.
questions in that regard.
Yeah. Any thoughts?
You mentioned alcohol. Does red wine have any effect with the red berry?
So if you're going to drink alcohol, red wine is perhaps the healthiest of alcohols, just because it tends to have more phytochemicals in it, resveratrol, different things that you've heard about probably in the news. But even red wine is, we say, well, you should be able to limit that too. Those of you that might be on hormonal or anti-hormonal treatments, you might actually, red wine is one of those things that tends to release, it interacts with, when you have any alcohol, it will interact, like Nora says, with your fat stores. And it will cause your fat to release estrogen. So if you are a man that's on hormonal treatment and you're having difficulty with hot flashes, red wine might be one of those things that actually really exacerbates those hot flashes.
Interesting. That's very interesting. Yeah.
David, I have a question.
Yes.
Hi, thank you for both ladies for the very interesting presentations. I finished radiation treatment for prostate cancer in December, and then I was on androgen deprivation therapy, bicalutamide, for 3 months. It exhausted me. I've been off it for 3 months and I'm still exhausted. I do exercise every morning, but then most of the rest of the day I'm very exhausted. What can you recommend to how to change my diet to help me improve this and get my vitality back?
Yeah. Now, with your exercise, are you doing resistance training?
Not very much. It's
Okay.
mostly walking and biking.
Okay. I would really recommend highly that you start doing some weights, either some free weights or using your own body weight to, like, for example, one of the exercises that we tell our guys that may not have exercise equipment is hold on to the, if you have a staircase in your house, hold on to the railing and get on your kind of on the balls of your feet. Let your heels drop and then raise and drop and raise and, kind of force yourself to on that stair to kind of lift your body weight so that you really build up your lower body, your lower muscle mass. And most of your muscle mass is in your lower body. Sometimes we think, oh yeah, you have to lift barbells. Yeah, I mean, it's true that doing resistance training in all parts of your body is good, but really trying to build that muscle mass in the lower region is very important. But it can take you a while to get back from that, from ADT. It's a tough row to hoe.
Thank you so much. Also, may I ask about flaxseed? The other speaker mentioned that flaxseed is beneficial. At one time, a nutritionist had mentioned for us to stay away from flaxseed, but I'm hearing you say that flaxseed can be beneficial. Is there a controversy about that, or?
there is a controversy, and I did the largest flaxseed trial that has ever been done in prostate cancer, and I did it when I was at Duke University. And we saw really favorable effects with and it's not flaxseed oil, it's flax, the whole seed. What we did with this one study is we had 160 men that were awaiting surgery. And so during this pre-surgical period, we assigned men to flaxseed, or we assigned them to flaxseed plus a low-fat diet, just a low-fat diet, or just not, basically a control group. And in the flaxseed treated groups, when we looked at prostate cancer tumor under the microscope, the proliferation rate of that tumor was a lot slower. So we found really good results, but again, not with flaxseed oil, but you take the flaxseed and you grind it up like in a coffee grinder. And you take 2 tablespoons of that a day, and you put the rest in your freezer, because the oil that's in flaxseed is very susceptible to getting rancid. So you don't want that to happen. So you keep it in the freezer. And you can grind it as you need it too. But there was a controversy because there was a study from Harvard where they found that the alpha-linolenic acid that's in flaxseed, when they measured men's blood, they saw that men that had high levels of this alpha-linolenic acid had a higher risk of prostate cancer. And so they made the connection. They said, well, gee, if you have high levels of alpha-linolenic acid, and we know that alpha-linolenic acid is high in flaxseed, oh, well, then it's bad for you. What they neglected to take into consideration is that some men are unable to, and it's a very small portion of men were unable to metabolize alpha-linolenic acid. And so it was one of those findings that they released a little bit prematurely, in my opinion. So I recommend flaxseed. I think it's full of nutrients, as Nora suggested. And it has lignans in it, which really keep your hormones regulated. And it also has a very favorable fatty acid profile that may inhibit prostate cancer growth.
Thank you so much. That's a very thorough explanation. I appreciate it.
Thank you.
Interesting. Are there any studies, Wendy, since the Duke and the Harvard studies that have followed up any further on that flaxseed question?
Yeah. I mean, we did a series of studies in different ways, and all of our studies found favorable results. Unfortunately, funding of nutrition, and there was just an article that came out about from the American Society of Clinical Oncology that I was part of the authorship team. The funding for nutrition related research is really bad. And so, yeah, we wanted to follow up our study with another study, because one study does not prove anything. You need to have kind of a good scientific basis for making recommendations. And unfortunately, diet related work is not funded well. So the answer, that was a very long answer to no, there's no other studies. Sorry, wasn't very concise.
Are there any studies out there that compare the benefits and the drawbacks of the various alcohols that there are. There's so many different varieties of alcohol. For example, scotch or whiskeys or
Mhm.
wine, beer. Is there anything that compares the value of each of those?
Well, maybe Nora can weigh in on this. All I've seen is with regard to colorectal cancer. And there they really say, well, you know, if you're going to drink, the red wine is better than beer or hard liquor.
No, I do not know of any studies that differentiate any, say, lessening effects to our body for choosing one type of alcohol over the other. I think that what Wendy said earlier, look, those of us that are social drinkers, you know, here and there, you know, that's a tough one because you have to navigate just how much you're going to drink if you're serious about utilizing all these recommendations. And, you know, it stinks because, you know, it's a social thing we do, but it is what it is. And we just have to make our own decisions about, you know, alcohol intake as well as everything else in the whole
Yeah.
wheel.
Yeah, a lot of people, you know, again, it's a trade-off, right? There's not going to be all of these recommendations that you follow, but if you say, well, gee, I really value, and quite frankly, I don't want you, this is what I do. I'm not saying that, you know, I am a nutritionist and I have my glass of wine come hell or high water with dinner every day. And I know it's not great for me, but I exercise. I really limit my red meat consumption. I eat a ton of vegetables. So I figure, you know what, I'm not going for sainthood here. I want to live a life that I value. And there are some things I'm willing to make you know, follow the recommendations. And there are some things that I think, well, you know what, life is short. So I'll do what I can.
Well, listen, you certainly have done a lot today. Thank you very much. My gosh, very, very, very useful information for all of us. And I know my primary cancer doctor at one point said to me, in trying to weigh all of these pros and cons and what to do and what to eat and what to do, he said moderation in all things. And I think that really was helpful in terms of absorbing a lot of material, but then making decisions that don't throw you off a cliff, but at least keep you alive.
Have any of you two nutritional ladies, Solar Bread, did you ever use that?
What is it?
The brand name is Solar, S-O-L-A.
Bread?
Yes,
Solar bread or S-O-L-A?
S-O-L-A.
I've not heard of that brand. S-O-L-A, Wendy, bread.
Bread, solar bread.
So
I haven't heard about it either.
Carbohydrates, net carbohydrates per slice.
So I look
Excellent.
Look at the ingredients. That's what I would have to look at because just reading the marketing stuff like that, you know, I want to see what are the ingredients. Yeah.
I have a picture of that.
Okay.
Yeah. When you look at a bread label, the very first ingredient should be like a whole grain. So it's not enough for it to say wheat bread, because most bread is made out of wheat. It should say 100% whole wheat flour or 100% rye flour or something down that line. I agree with Nora. You gotta read the label.
Now, what about Trader Joe's? I shop there a lot. Impossible Burger. That would be good.
Yeah. That's good. I mean, that is a good alternative to you know, to eating red meat.
Yeah, it's all vegetable protein, and it's
Mhm.
excellent. Those burgers,
Right.
you could fool anybody. You could
Yeah.
grill it outside, put a piece of cheese on, put it on a bun. It's absolutely tasty like a burger. But they also have chicken strips
Yes.
and meatballs. We had the meatballs last night.
Yeah, it's amazing how much it tastes like a regular burger, isn't it?
Yeah,
Very good.
interesting.
But I don't eat any red meat.
Yeah.
Well, guys, I think we're
Okay.
full of information. I know we are. Wendy, thank you so much. That was a.
Yeah, well, thank you, and I really do appreciate being part of your support group today. Thanks.
Great to have you. Thanks.
Okay, bye-bye.
Nora, of course, as
Bye-bye.
well. We'll keep in touch.
Yep. Bye-bye.
Make sure I send out information regarding the Amplified to everybody.
Thank you, David. I appreciate it.
All right, folks, thank you. Have a good evening.